prior to the dental extraction procedure, if you are taking anticoagulant like warfarin, Aliquis, or Xarelto, you should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any retinal patient. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially uh, it higher your upper range. You should check your eye now prior to procedure to avoid bleeding. So um, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want iron between 2 and 3, or they want iron less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that uh, your iron expect to be at certain level prior to the procedure. Usually, they want your iron on the day or within 24 hours prior to the procedure. So if depend if your iron excuse me, if your iron um not stable, or higher than the upper range, like a week or 2 weeks prior to the procedure, then um, your doctor may recommend that you should hold your warfarin, to make sure uh, you get or you achieve the iron goal. Expect to be uh, within 24 hours. So, for example, if your INA like 3.5, 2 weeks prior to the procedure, right? So, um, I would recommend, you need to hold your warfarin uh, 1, 2 days prior to the procedure, and then you need to detach the INA on the day of procedure. So, to make sure your INA at 2.3, I mean 2 to 3, that what your dentist want. If your dentist want your iron less than 2 prior to the procedure, then you might need to hold for 3 days. If your iron uh, you know, were 3.5, 2 weeks prior to the procedure, then you need to hold like 3 days um, prior to the procedure to make sure you are not less than 2. So it still depends on what your dentist want or expect you are not level or goal before the procedure. If you have to hold your eye I mean hold your warfarin for 5 days prior to the procedure. Okay. Um, Sometimes they have difficult or multiple tooth extraction. Um, they may want you to hold for 5 days prior to the procedure. They want the INR level less than 1.5. then you need to hold your warfarin might be for 5 days or more, depending on your iron level. So you have to follow your doctor closely to make sure uh, you know, you don't have any help bleeding. So if you have to hold your warfarin for 5 days to get the iron uh, at less than 1.5, then you might need to be breached with the lower knock injection or enoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin prevent to prevent the blood clot or stroke. And then if you require to reach with the lower knock injection, then there is a instruction, when to start the lower knocks and when to resume lower knocks injection. You have to follow the doctor who manage the doctor who managed your warfarin. Um, if you take Eliquis, Yeroto, or Badaxa, it's easier to manage prior to the procedure. Um, Generally, for a simple extraction, you don't have to hold Eliquis, Yeroto, or Badaxa. But for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days uh, these medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe, except for certain patients. Um, they are so sensitive when they hold their blood thinner medication, even though 2 days, they may develop the blood clot or stroke. So for those patients, um, you know, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that is very complicated. Patient need to work closely. They may need to be uh, stay at the hospital uh, before the procedure to make sure they are safe, or stay uh, after the procedure for a couple of days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the aliquid Yeroto, but that's then you resume your platinum medication as instructed by dental or the surgeon. So prior to the dental extraction procedure, you need to know if that a single extraction or multiple tool extraction. Okay? If simple extraction, you may not need to hold your platinum medication. If multiple tooth extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your iron level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take Aliquid, Yeroto, or Badaxa, You may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then um, you should resume your blood thinner medication as instructed by your uh, dental. And if you have to be bridged with Lovenock injection, then you have to follow uh, your doctor who manage your warfarin to make sure you know what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right. If you have any further question for this dental extraction procedure, please let me know in comment below. Thank you.